Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 23, Calamure 2. Calamure for nose problems with white or grey-white coating on tongue, thick yellowish snivel from snout, thick mucus, strict blood from frontal sinus, dense cough from crest of pharynx along with characteristic tongue of Calamure. Calamure for face problem, painful swelling of cheek along with Pharynx should be applied, facache with swelling of gum and cheek. Calamure for mouth problem, ulcers in mouth and lips, burning in mouth with swollen glands and gums, aphthous ulcers in mouth of children. Now the images. The first image relates to the sinuses. These two are frontal sinus. Actually, these are actually these are for top as a frontal sinus. These are maxillary sinus. These two are maxillary sinus. They are frontal sinus, and there are also within the brain skull cavity there are two, that the modal sinus and sphenoidal sinus. So anyway, but just frontal sinus and maxillary sinus are most involved. It is written here that from frontal sinus, thick yellow, graduated thick yellow nose, thick mucus stick with blood from frontal sinus. The disease comes out from nose. Pharynx. Pharynx is the area. This is the this is mouth. This is the tongue. This is nose. Nasal opening. Nose. From here to this portion is called pharynx. Pharynx has got actually three portions. First one is nasopharynx, then oropharynx, then laryngopharynx. So this whole portion is pharynx. Here actually it is that pharyngitis, that is inflammation of pharynx, swollen gum. The gum is swollen. If you note the gum is swollen, and aphthous ulcer, particularly in case of children. This is aphthous ulcer. This is a very painful ulcer. Aphthous ulcer. Calamure for tick problems. Toothache with swollen gums and cheek. Boils on gum before pus formation with Pharynx or silicea also may be required in this case, because you know pus various in most of the cases for silicea for pus formation, silicea, calcarea, sulf, and Pharynx is also used here to arrest the inflammation. Calamure for tongue problem, dry wet tongue with white or grey-white coating, swelling and inflammation of tongue. Pharynx also recorded here. Calamure for throat problem, pain in throat, white or grey patches in throat. Cast anchor for diphtheria, tonsillitis, pharyngitis. That is for three diseases. Tissue salt therapists cast anchor, that is most important medicine at this calamure. Give 6x 3-4 hourly just when swelling starts. Quinsy, acute or chronic. Quinsy means actually boil in the tonsil area. Very painful disease. More excruciating pain than tonsillitis. In all throat affection, gargle with water mixed with calamure is very much beneficial. That is a local use. Local use, you can use it along with medicine, then cure will be faster. Now the images. The first one is pharyngitis. This is the actually oropharynx. This whole portion is inflamed. That is pharyngitis. Tonsillitis, clearly see the tonsils are swollen and with streaks of pus. Quinsy, this is quinsy. This is a boil has formed on the tonsil, and so that the uvula is pushed aside. So big is a tonsil, I mean the abscess is, so it has pushed the uvula in the side. Diphtheria. This is diphtherial patch. Diphtherial patch is from coming out from within throat towards mouth. Though in these days for diphtheria, very few patients will come to tissue therapist because it is a bacterial disease. Generally, modern medicine looks after this. But you can also, as an tissue therapist, you can also treat a diphtheria if you have the capacity to do so. You have to learn a lot, have confidence much, then you can only do this. But generally in these days, it is very rare patient comes to tissue therapist for diphtheria. Calamine for throat problem, loss of voice, mumps, alternately with pharynx. Hawks up offensive, cheesy, small lumps, symptomatic sore throat. When there is profuse saliva with swelling of testicle, calamine should be given alternately with natrum mure. This is a particular situation. Profuse saliva with swelling of testicle. Special situation. Calamine for stomach problems. Loss of appetite due to sluggish action of liver along with characteristic symptoms of tongue. Soreness at the lower angle of right scapula. Lower angle of right scapula. This is the soreness at this area. Cannot tolerate food rich with oil, fat, gastritis, stomach swollen, burning, sore, irritations, vomiting of cloudy mucus, blackish blood, constipation. Tongue of calamine is shown here. This is the far tongue. This is called far tongue. This far tongue is a characteristic symptom of calamine. And mumps. Also, mumps. Calamine is a very good medicine for mumps also, but same thing. Very seldom now patient come to tissue therapist for mumps because mumps is an infective disease. For infective disease, generally patients used to, patient party used to go to modern medicine. No matter, but the tissue therapist have the scope also. Calamine for abdomen and stool problems. Constipation due to sluggish liver. Stool whitish, muddy, jaundice, tongue whitish or grey white, furred. Eyes swollen or related to dysfunctional liver. Lower abdomen swollen, diarrhea, dysentery, especially after fatty food. Pain in anus with pharynx. Typhoid, enteric fever with loose bowels, flocculent stool. For second stage of inflammation of gaster, gaster means stomach, and intestine, peritonitis, appendicitis, typhlitis, perityphlitis, enteritis. Bleeding with piles, blackish and dense. Now, the images, swollen eyes, face with swollen eyes is clear. Peritonitis, peritoneum. We had a thin connective tissue layer in the covering the inner side of the abdomen and abdominal structures. It's called peritoneum. Inflammation of the peritoneum is called peritonitis. It's a very serious disease. Peritonitis. In earlier days, Kalium used to be used in these cases, but same thing, since it is mostly in the infective case, modern medicine has taken the advantage more. Appendicitis. This is the normal appendix. This is inflamed appendix. That is, appendix inflammation has occurred. Appendicitis is there. It is also a very acute, very emergency disease. Typhlitis. Typhlitis means when the large intestine starts, it is called cecum. This inflammation of cecum is called typhlitis. It is another very serious disease. In present days, actually, this disease used to be seen in cancer patient, patients of HIV, AIDS, or serious disease where the immune system has been damaged. Typhlitis, bad type of disease. Enteritis means enteron. Enteron means actually large intestine. The wall of the large intestine is inflamed. That is enteritis. Now there are serious diseases also here in enteritis form. Crohn's disease is some sort of enteritis, but much more problematic than ordinary enteritis. But we have in homeopathy has a great scope in Crohn's disease and ulcerative colitis. Because these are autoimmune disease, modern medicine had no medicine here, no remedy there, here actually. Modern medicine had no remedy here, but we have. Like this, 10 years old Raju came to my chamber with his daddy. He used to suffer from fever often. Temperature rose to 101 degree Fahrenheit, stayed about 2 weeks or more, then relieved. Generally, physicians and modern allopathic medicine were consulted. Appetite was less all along, had anemia, tongue had white coating, face a rather pale yellow. Kalium in 2 grains dose 4 times a day was prescribed for 5 days, advised to take also enough liquid food with glucose. On 4th, the report came, fever had not risen above 99 to 100 degree Fahrenheit for last 2 days. Advised to continue the medicine for 7 days more in the same way. After 10 days, Raju's father rang me to inform that fever had gone completely. He was much elated as fever did not stay as longer as usual. Advised him to continue the medicine twice a day for few days more. With this video ends. Thanks for listening and viewing. If you got anything to say, please write in the comment section. I will certainly respond.